Now, abnormalities, we can have tenosynovitis. Okay, different types of tendinopathies can be there. We can have hypertrophic tendinopathy, atrophic tendinopathy. Then insertional tendinopathy, we already discussed at the site of accessory navicular bone. It can rupture, it can suppress it. Okay. Subluxation, I've told you two tendons. You have to always check. One is your tibialis posterior and one is your peroneus brevis. Okay. I did not understand your doubt. What is TPT, PD? Okay. This is tibialis posterior. This is peroneus brevis. The context in which I told these tendons that these are the two tendons which most commonly show dislocation or subluxation at the level of ankle joint. So these two you should be knowing the normal locations in your mind exactly. Okay. Even if you forget the rest of the tendons, no problem. But the normal locations for tibialis posterior and peroneus brevis, they should be always kept in your mind. Okay. I've seen most of the residents, they usually miss this dislocation because they do not know the normal locations of this. Okay. So this is your tibialis posterior tenosynovitis. Okay. You will have fluid along with that. Okay. Then we can have different types of tendinopathy. As the name suggests, hypertrophic, there will be thickening and enlarged. Along with that, they will have heterogeneous internal segment densities. Okay. So this occurs, there's a staging of PTT dysfunction, this tibialis posterior dysfunction, which has been given. Okay. We need to go into the details of the staging. Just remember that initially we have hypertrophic tendinopathy. So whenever the dysfunction starts, initially what happens is because of acute inflammation, this tendon gets thickened. Along with that, we have internal heterogeneous segment densities. Then what follows is your atrophic tendinopathy, followed by that is in late stages, what happens is there is volume loss, there is thinning, okay, and this consequence since it now the thing has gotten chronic, so there is advanced tendon dysfunction. And I told you one thing you remember is acquired flat foot deformity. Hypertrophic tendinopathy, I told you, is an acute kind of thing. So you have your peritendinous fluid and tenosynovitis in the proximal part. And in again the later stages, you can have calcific tendinopathy as well. Okay, so it can be seen in chronic degeneration also, and there can be some systemic causes also. Okay, so you have hypointense or signal void areas which we on all sequences. So this we know how calcification looks like on MRI. Okay, so PD dysfunction starts with hypertrophic tendinopathy followed by atrophic tendinopathy. Okay, and calcific tendinopathy can occur at any stage. So you see a enlarged tendon. I told you it should be 2 times, but in this case you see there's almost 3 to 4 times. So that is why I told you normally it should be 2 times that of the size of FTL in aperture. But if it's come more than 2 times, you will say that it has enlarged. Okay? And you'll have some internal heterogeneous segment density, not shown here, but okay, if there is, then it's a hypertrophic tendinopathy. And if you do not see any internal heterogeneous segment densities, you can sometimes label it as hypertrophic PTT dysfunction also. Okay? So we can have hypertrophic tendinopathy / dysfunction, depending on the amount of heterogeneous segment densities within the tendon. Hypertrophic, thickened. Okay. What's a McCoy degeneration? If I say it has a speckled appearance, okay, I only take the McCoy degeneration. I give the McCoy degeneration whenever there is just a multifocal speckled appearance. Okay. If I'm not sure, when I'm not able to differentiate whether it's a tear or it's a possible interstitial tear or it's a possible McCoy degeneration, I can give both of these things as well. McCoy degeneration is also usually reserved for Achilles tendon only. The term is not used in relation with posterior tibialis posterior tendon. So there is no confusion with respect to your tibialis posterior tendon. And with respect to the Achilles tendon, prefer giving McCoy degeneration whenever there's a classical appearance of multifocal speckled appearance. Okay. Otherwise, you can give both the possibilities. Okay. Okay. So you can see there's a posterior tibialis tendon which is bulky and enlarged with respect to your flexor digitorum longus and flexor hallucis longus. You see it's a internal heterogeneous signal densities also. Okay. So, and you have surrounding phenotype as well. So this labels are hypertrophic dysfunction. Okay. So if you have your surgical images, you can confirm whether it's a tendinopathy or a tear. Accordingly, you can use that. Okay. So if you just get an axial image for this, you can just write it as hypertrophic dysfunction of the tibialis posterior tendon. And if you have your other images, you can confirm whether it's actually tendinopathy or it's a tear. Okay. Moving on to the atrophic type tear. Okay. So now the size will become less than 2 times in comparison to your other tendons. Okay. So you see there is a thread-like posterior tibialis tendon. So normally I told you it should be 2 times. So now it is atrophic. Along with that, it has internal heterogeneous signal density changes as well.